All right, everyone. Welcome back to Chiro Shift, the podcast that will change your perspective of the chiropractic profession. I'm Dr. David Newton, and today I'm joined by my co-host, Dr. Devin Pioli, and guest and all-around badass, Dr. Natasha Barnes. Natasha is a chiropractor, coach, elite-level powerlifter, and elite-level climber. She also hosts her own podcast, the Strong as Fuck podcast. Currently, she primarily works with climbers who want to learn how to overcome injury and build strength so that they can reach their full potential in a healthy and sustainable way. So, welcome to the show, Natasha.
Thanks for having me. It's so great to be on with you and Devin.
Yeah, it's great that you're here. So I'm going to let Devin lead in today. I know he has a few burning questions that he wants to get to you right off the bat here.
Yeah, so first of all, super excited to have you on here. I know we've chatted before. And from my understanding, so former bouldering national champion, right? Like 19, or you've been climbing for 20 plus years now, which is a cool thing. Also, on top of that, and I know these things don't often go together, is an elite level powerlifter and a national champion in powerlifting, which is just super cool. So you're definitely the coolest one on the call. And, that's kind of what we do here. Just have cooler people on the call because it makes us look cool, right? No, I'm just kidding. No, we think we'll have a great conversation out of this. But from my understanding, just kind of like engaging with your content and listening to some of the stories that you've told, I think that it was an injury that you had that led you into the realm of strength training. Is that correct?
Yeah. I had a couple shoulder injuries that weren't getting better with the traditional care. And I just sort of had a hunch that strength training would help. And that's sort of how I got into it.
Yeah. So could you dive in a little bit on that and just because I think you've spoken to your frustration going through that process, and it wasn't necessarily because I know one of the things that you speak on is a frustration with people within healthcare not really knowing how to deal with climbing injuries specifically, and listening to you talk about that, I think you can lateralize to a lot of MSK issues where it's just back pain, shoulder pain, hip pain, knee pain, whatever. Could you speak about that experience that you had trying to overcome that?
Yeah, totally. So, climbing's really intensive on your upper body, and shoulders are probably one of the more common injuries that we see in climbers, is probably one of the top three. So not too surprising that I was dealing with a couple of shoulder injuries. I'm also hypermobile, and I've had a dislocation, or rather a subluxation in one of my shoulders before. So I had that history going into it. And yeah, I went the traditional round. I worked in a clinic where we had PT and chiro mixed together. So I just talked to a couple of PTs there. They gave me some things to do. A lot of it was focused on fixing my posture and, getting my thoracic spine more mobile, because climbers tend to have more of a kyphosis and more of a stiff upper back. And so I spent a lot of time mobilizing my upper back and, doing the classic rotator cuff exercises and all of that. And it did help a little bit, I think, doing some of that stuff, but it didn't really get me to a place where I could climb as hard as I wanted to. So I was sort of stuck with that. And I had this hunch at the time, and now I know that the traditional PT often isn't taken into consideration, and this goes for climbing, but it goes for other sports, the demands of the sport on the athlete. And the problem with the traditional exercises is they end up being quite underdosed for somebody who's climbing at a high level. And so it wasn't quite enough to get me to where my shoulders could tolerate the climbing that I wanted to do again. So that's how I got interested in strength training. And I always knew that I wanted to get into it too, because um, I'm lucky enough to have pretty decent finger strength just naturally. And I was lucky enough to grow up. I've been climbing for 25 years, and I grew up climbing with some really good climbing coaches who were able to teach me really good climbing technique and really good climbing tactics. So I really felt that my rate limiter in my climbing was absolute strength, and it was something that I wanted to get better at anyway. And so ended up going to a gym that was actually right near my clinic, where they had barbells and kettlebells, and started working with one of the trainers there. And yeah, kind of fell in love with powerlifting, to make a long story short, and sort of the rest is history, and kind of dove into that rabbit hole as a result.
That's awesome. And one thing you mentioned, and I want to bring it back to that point for a second, was you talked about the demands of the sport and maybe how traditional PT or traditional rehab wasn't really meeting the standard to allow you to maybe return to or excel at your particular sport. So I think when we look at, some of the patients or clients that a lot of us have worked at throughout our careers, a lot of them have goals beyond pain, right? They might come in for pain, but for a lot of them, pain is preventing them or holding them back from really reaching the levels that they want to get to. So I know your background is a chiropractor as well. Speak a little bit about maybe some of your experiences and how also being a chiropractor and then eventually getting into more of the strength and conditioning world, the powerlifting world. How can these two ideas come together to ultimately provide a better plan of support for our patients? Because a lot of them are seeing chiropractors that maybe aren't involving other aspects of care outside of spinal manipulation. What can care look like, and why would some of these other aspects be so important for those particular clients or patients?
Yeah, totally. Yeah, I mean, physical therapy, chiropractic care, traditional anyway, like a lot of those things have a similar downfall where, like in a traditional chiropractic care, you're going in, you're getting manual therapy, maybe you're getting like soft tissue work, maybe you're getting like adjusted, which is great and it can feel good. And like for some people can maybe help mitigate symptoms like short term. But we run into the same issue where, uh, those things aren't going to build like tissue capacity or tissue tolerance to be able to do what you want to do. And so at a certain point, like if you're going to a chiropractor or if you're going to a physical therapist, like the training, the rehab that you're getting or the care that you're getting needs to be like challenging you so that you can build more strength, build more capacity. And if that's not happening, it's going to be really hard to like get back to the level that you want to get to, even though like early on, like maybe some of those more traditional exercises might be helpful, maybe some manipulation can be helpful or some soft tissue work can be helpful at the beginning for maybe mitigating symptoms. It stops helping after a while, and that's sort of like something that I started to notice with my patients because I was right away out of school, like I was highly involved in the climbing community. So people like knew what I was going to school for. I was like immediately already seeing a lot of climbers like right at the beginning of my practice. And I started noticing like those were the things I learned in school. So those were the things I was like doing with people. And I started realizing like, yeah, initially like this is helpful or they're reporting like positive, like this makes me feel better. But then at a certain point, they're coming back because they're like, okay, but like when I try to climb as hard as I want, like the pain comes back, or I'm just not able to do those hard climbs still. And so I had to sort of like figure that out. But luckily, like at the same time, I was also starting to get into strength training and I saw how much it was helping me. And so it very quickly became something that I incorporated with my patients and my clients, kind of like really early on in my practice. Um, so I was lucky enough to like probably not the first clinic that I worked at, but after that, go to places where they did have like actual strength training equipment and like a gym, like in the place that I was practicing so that I could help people with that stuff.
And I want to go back to one more point that you had there, because I think this is so incredibly important for people to understand, is that when you're getting adjusted or manipulated or having your back cracked, the positive benefits of this tend to be relatively short-lived. As Natasha just mentioned, they're really there to mitigate symptoms, to reduce pain, to allow you to feel better in the moment. So if you're being fed a narrative that is very much along the lines of, if you don't do these things, you will be broken, or you will be at higher risk of injury, or X, Y, and Z negative things will happen, we want to very much reassure you that this is not so much the case, and that the things that are really going to help you moving forward much more fall along the lines of what Natasha just spoke about. Are you challenging yourself to build strength? Are you challenging your tissues to have more capacity to the demands of your sport or your daily activities or your job or whatever it is? And it's continually progressing in that realm. That tends to be one of the most important things that you can do for yourself. And I want to emphasize for yourself, because these relationships, and I know all three of us here very much feel very strongly about this, your ability to take care of yourself, that responsibility ultimately is yours. And we are here to guide and to support that and to really provide the path that for you to begin to take down these routes. If your practitioner is ever making you feel that you need them to feel good at the end of the day, That's not the type of relationship that, as a healthcare practitioner and patient, we should be aiming to have. So I really thank you for bringing that point up, because I think it's so incredibly important. So I want to kind of get a better idea of how your chiropractic career has evolved, because I know you've been, it was a while since you've been in school, and it sounds like you were very much immediately involved within the climbing community. Talk a little bit about, for yourself personally, how has your perspective or your mindset in regards to chiropractic shifted throughout the course of your career?
Yeah, it's changed a lot. I mean, initially getting into chiropractic school, I didn't really know like what it was really about. My dad used to go to a chiropractor who was sort of like a sports chiro, and he would do sort of like combination, like manual therapy adjustments and like exercise. So he did have like that going on in his clinic. And my dad was an athlete growing up, so I got to see how this chiropractor helped my dad. And I really liked that, like the idea of like working with athletes or working with people who are active and like helping them get back to like their sport. So going into chiropractic school, that was sort of like, that's what I want to do. And I picked the school that I went to, which actually is like in the process of closing right now, Palmer West in San Jose. I think it's still open, but I think they're just sort of like keeping going until the last cohorts are graduated. I think there's another Palmer like on the East Coast or something, but that's the school that I went to. And they did have like a sports medicine club and like some sports medicine stuff you could learn there. And they did have classes that are part of the curriculum of like evidence-based, like learning how to read evidence, learning how to read a research paper, which I thought was really cool. Um, but like, yeah, initially going into it, I was like, oh yeah, like chiropractic makes sense. Like, why wouldn't I want to adjust people and help them feel better? And it was a little bit less of the traditional chiropractic narrative of like subluxation based, but that's still obviously taught in school a little bit. But I think pretty much in school, I kind of got to see how there was like a lack of sort of evidence and support for just chiropractic care, just manipulation alone. And I knew right away in school that there were other things that I wanted to like incorporate into what I was doing. Um, Unfortunately, when I graduated, I started working at a clinic that I thought was gonna be really cool. It had like physical therapists, they had massage therapists, they had medical doctors. So it was like kind of a big space with lots of practitioners. And I thought that was really cool to be able to like collaborate and like learn from each other. But it ended up being a little bit more of like one of those mill clinics. And so we only got like 15 minutes with patients. So a lot of what I did in the beginning was just like a lot of manipulation, a lot of like quick and dirty, like manual therapy, because we didn't have a lot of time with clients. But I felt really unsatisfied with like the results that I was getting for people. And just also unsatisfied with the experience of working there, which is like a whole other story. But yeah, so quickly realized I needed to like get out of that place and like go to a place where I could do the things that I wanted to do with my clients. And that's why I ended up working at the next place that I worked at, because they had like a Pilates studio and sort of like a gym space there. And I was going to have more time with clients, which I wanted, and be able to do some of the exercises and things and like education and things that I wanted to be able to do with clients that I literally did not have time to do when I first graduated. And so it's just sort of like progressed from there. The next space that I worked at was like a full gym, and I was like literally teaching people strength training, which was really, really cool. And then from there, it also kind of evolved to be more of like a hybrid practice where I was also like coaching people online, and doing like a little bit of remote stuff on the side on top of like seeing people in person. And then with 2020 and everything, I ended up having to go 100% online. And that's where I've been ever since, because I really enjoy it. I can reach climbers and clients that are like all over the place, who might not have access to somebody who works like me or who understands their sport. So that's been really cool to help climbers from all over the place. A lot of what I do, like because I ended up finding out, like, when I was still in person, like, closer to 2020, that, like, some of my sessions, we would literally just sit down and have a conversation, and nothing would even happen in that session. I wasn't teaching them exercises, I wasn't doing manual therapy. It ended up literally being just, like, a conversation to help them understand what's going on, reassure them, and give them sort of, like, a trajectory of, like, what they needed to do next, and I started realizing, like, we could do this on Zoom. Like, I don't need to be sitting here having a conversation with this person face to face necessarily, and it can be more convenient for both of us to do online. And then, clients who do need exercise or do need support with that have ways to support them that way too. But so that's sort of where it is now, and it works really, really well.
Yeah, that's awesome. And I think I just want to highlight that last point too, because I think that it's so undervalued, that just the power of that conversation, and how much you can do with just, you know, providing some knowledge, setting expectations, and then reassuring somebody throughout that process. And yeah, I feel like, even in my experience, like a lot of people come to you, and I think it's given the nature of the fitness industry as well as healthcare, where they're looking for that fix, when in reality it's like,
Mhm.
just keep on keeping on, right? And stuff tends to kind of fall to the wayside after that. So I like really agree with that. Just the power of reassurance and the power of conversation. I find myself in a very similar position. Kind of backtracking a little bit, because it sounds like you have a very common experience within that chiropractic, where you kind of go into, like, I also didn't really know much about chiropractic before I got into it. I did a semester long internship, had a great experience. Like, I was just taken care of there, ended up working as a front office manager for a little bit. That's how I ended up in Chiro school. And it was really like my experiences in training that allowed me to kind of see past some of what was happening. Where it's like, you know, given the principles of adaptation, some of the things that are being talked about just don't really make much sense. And then kind of reflecting back on my experiences in chiropractic and being able to see, it was like, oh, that was definitely just kind of like this mill style clinic. Um, what do you like? And it sounds like you've also had positive experiences, like with your own coaching. So, what would you say? Like, what do you look for in terms of qualities when you're seeking out a good coach? Just kind of for the people listening, what some of the are the things that you look for to be like, okay, yeah, I'm in a good spot where my best interest is in the forefront.
Yeah, I mean, I think working with somebody who's like willing to listen to you and like hear you out, hear what your goals are, um, somebody who's not gonna like force you to do something like a certain way just because they think it's the best way, like figuring out what's gonna work for you. I think is a good sign. Like if somebody can meet you where you're at, and somebody like with my clients, a lot of times like I'll do a call with someone who's interested in coaching, and they'll be like, all right, like I'm all in, like I want to like do this. I want to like do 5 days a week. I'm ready to just like go. And I'm like, well, let's talk about like your life first. Like what's going on with your schedule? What's going on with your work? What's going on with your kids? Like to me, it sounds like five, however many days a week you're saying right now is like pretty ambitious. And I want you to like be able to check off the boxes, build some momentum, feel like, yes, I'm doing this. And I think people get more results or get like build more momentum and get better results if they're able to do that. So sometimes it's about me being like reality checking the client and being like, hey, you're coming into this with like the most ideal scenario here, but like let's be realistic. I think like 3 days a week would be a lot more realistic for you. You're going to build some good momentum, you're going to build in some good habits of getting into the gym regularly, and then if we're nailing that and you're starting to get bored, then we can add like more to that. And I'm like, yeah, you're right. I'm really glad you said that, because like 5 days a week was sounding like kind of like and I'm like, yeah, like let's make sure you're successful here. So if you can find a coach who's like really taking into consideration your time constraints, your lifestyle, your goals, and is willing to have a conversation about you with that about you, and not necessarily like make you do what they think you should do, but like have you do what's going to be best for you, is a really, really good sign.
And I'm glad you mentioned some of those things in there as far as just getting to know your patients or your clients, because I think too often, and I know many chiropractic offices in this way, many chiropractors have had to work in situations where you have very limited time for patient interactions. 15 minutes might be generous in some clinics, but we do know at the end of the day that there is not enough time to get to know a person to really be able to make quality recommendations in that little of time. It just can't be done at the end of the day. So, like Natasha just mentioned here, if you feel like you've never had the chance to tell your story and your practitioner hasn't asked you about some of these other things that might be going on in your life that are making your weeks hectic or stressful or challenging, a good healthcare practitioner is going to take the time to begin to understand these things so that they can begin to create a treatment plan with you that's going to work for you. Because too many people get a cookie cutter plan. Okay, you have shoulder pain and you're a climber. Here's, you go do this. You're going to do the same as every other person. You have back pain and you're a power lifter. You're going to do the same thing as everyone else. And there's no consideration given to the individual characteristics of who you are and what your life is like. So just to add on to that really quickly, I think some of the characteristics you can look for in a practitioner really are, again, to emphasize that they're going to take the time to get to know you, to ask some of these questions, and then to create the plan with you instead of just directing it at you, which I think is far too common. So I want to transition now into this next part of the conversation, which I think is pretty important, and we'll probably emphasize this in multiple episodes this season. But I still think there's this idea and maybe the stigma around the chiropractic profession and people who are chiropractors, and how they must work and what we do. And for both Devin, Natasha, and myself, doing work through a computer, through Zoom calls, like how are you possibly able to work with clients or individuals that does not involve seeing them in person and performing some type of manual therapy there? So I know you mentioned that you're 100% virtual now, Natasha, but for the audience, could you explain a little bit more about how that type of relationship can work and really how you are able to help individuals simply through a computer by talking to them and guiding them through the process?
Yeah, totally. I mean, yeah, first of all, it can be more convenient for you because you don't have to show up anywhere. Um, B, we're gonna have plenty of time to like discuss like your life, your constraints, your goals, because we set aside enough time to be able to talk about that. We're not gonna have like a 10 or 15-minute appointment. I know for me personally, I set aside at least an hour for an initial session with somebody so that we have time to discuss all of that stuff. Number two, like a lot of what we were saying here is like, manipulations, manual therapy, those kinds of things aren't going to be as important as some of the training that you actually really need to do and some of the education that you might need about how you're training so that you can get back into your sport. That's going to be more important. And that doesn't necessarily need to happen in person. That can happen through a conversation, and that can happen through us trial and erroring like like a program for you. Um, and a lot of the time, like I don't necessarily like need to see you climbing. I don't necessarily need to do a physical exam on your body to know what's going on. For me, I've worked with enough people in person that I'm probably going to already sort of know. And also I've worked with enough climbers. I'm already kind of going to know like what's going on. So I have that experience, but also I'm going to talk to you. I can have you do some stuff up on the camera. Like, so does it, is this position? Is it like this position? Like where are you feeling it? And from there, we can sort of like deduce, okay, I think like this, obviously we're going to do some general training that's probably going to help bring up your strength and capacity. Maybe we'll add a couple specifics in there based on like your symptoms that might help address your symptoms. And we can do that just through a conversation. And a lot of it is less about like, I know people look at us as chiropractors and are like, well, don't you want to like look at my posture or like see how my shoulder blade is moving and like fix that? We're not really looking at that because we know that stuff doesn't quite matter. And especially like for my population with climbers, we look at a lot of shoulders and we know that like scapular kinematics are not correlated with pain. You can have like weird shoulder blade movement and not have any pain. You can have perfect shoulder blade movement and have like really severe shoulder pain. So we're not looking at that. And we're also not looking to change that because you can have your pain reduced without changing any of that also. So for us, it's just sort of about figuring out what your goals are, figuring out a good plan that's going to help you get there, and figuring out some specifics of what we might want to have in that plan based on your symptoms, based on like your goals, based on like your time constraints, and maybe like some of your equipment. So we can figure all that out through a call online, and we can do multiple calls if we really need to. Like if we need to have you try some stuff and come back and report back and have a conversation about it, we can have like a follow-up call to have even more discussion about that. Or I will have clients like send me videos of them if they're not sure. Like some people like, oh, I've never done any strength training. Like I'm really scared to do like a shoulder press or something with how my shoulder is feeling. And I'm like, that's very real. And I totally understand that. What we can do is start really, really light. Like the gym's going to have like 2-pound dumbbells or 5-pound dumbbells that we can start with. And you can like work up to whatever feels comfortable for you in that session. And then you can report back and we can talk about it. And if you're not sure if you're doing that exercise well, we can see a video of you and I can give you some pointers that might help you move a little more efficiently or help that movement feel more comfortable for you. We can do that over video. So that's sort of how I handle all of that.
Yeah, I'm in a very similar camp when it comes to assessment, and I've actually been down the rabbit hole of doing like range of motion assessments, like shoulder flexion, hip flexion, and what I found, at least, and I'm not saying like right or wrong, because I know people who very effectively use them and like make the decisions that they need to make. But what I found is I was just making the same decisions that I would have made after the call anyway, based on like market access, your previous experience, what your goals are, painful, like palliative and provocatives that somebody tells me about. So yeah, I'm very, very much in the same camp there. Now, do you want to like shift a little bit here, talking about like, I mean, it's kind of in line with this of just about building value around what you do, and kind of specifically with the population that you work with, that you work with climbing. Because I think there's a lot of things to lateralize here. So, what are some of the common misconceptions that you see within that community, and how do you overcome those?
Like misconceptions with like the injuries they come to me with, or
Sorry, yeah, should have been more specific there, but like the strength training. So like your delivery of like a plan for them and like building buy-in towards like, hey, like strength training is probably a really good option for you.
yeah, I think a lot of the misconceptions are like, some people might be nervous to like do any kind of training because they're having symptoms. But we can, I always reassure them, like, we can find something that feels tolerable for you. And the conversation I end up having a lot of times is it's okay if something feels slightly uncomfortable. Like, that's actually okay. And for shoulders specifically, also, we have research that shows that leaning into a little bit of discomfort will get you better outcomes than keeping your rehab completely pain free. So we're okay. We can be okay with a little of discomfort. And I always reassure my patient, like, I obviously want it to be tolerable for you, like during your rehab session. So, don't push into anything that feels like super painful or super threatening to you. Just work up to what feels tolerable for you in that session. Even if it doesn't feel super challenging yet, that's okay. We're looking for like a starting point. And I always tell them like the real tell is kind of like a rule of thumb I have with my clients is like we should make sure that you're not worse like 24 to 48 hours after a rehab session. And as long as you're not worse, like, 3 days later, we're good. That means you picked a good load, your shoulder or whatever body part was able to tolerate that and recover from it. And like that's a good starting point for us and we can build on that. So sometimes they're just nervous about kind of finding that starting point. But I think once I give them that reassurance and like some rule of thumb of like what they can follow for guidelines, it makes them feel a little bit more comfortable about doing that. And then I also reassure them like we can look at videos of your movement. We can, make sure that we teach you how to do this so that you're moving things well and that you're moving things in a comfortable way. And it can be a little bit of a process and a little bit of like trial and error to find the right starting point or the right exercises for you, but we'll be able to do it. And it's something that they're not getting anywhere else anyway, because the other providers they've typically been to, for me, I'm usually not, unless somebody has given me like a great referral or something, I'm usually not like the first person they're seeing. They've usually tried to go like the insurance route or like to somebody else that got recommended. Or I went to this guy because he rehabs triathletes, and I'm like, yeah, but you're a climber and it's like all upper body. That guy doesn't see upper body very often, so he might not know, or they might not know. So I'm usually like, second, third, fourth, fifth person this person is seeing already, and they're not getting that kind of information or help in these other places. So they're usually stoked to get like a different perspective, and they're usually stoked to be reassured that they can still climb and that they can still do things with their body instead of being pulled like, well, this, your shoulder's moving wrong. You can't do this. You're not doing this right. So we have to take it away. Like, trying to build some positivity and like build some trust in their body so that they can start moving again.
I bet they're so happy when they find you. I mean, just to have a provider in their corner that provides the level of reassurance that you do. And I'm sure everyone that's listening to this can tell that just by you talking about what you do, because you speak about it with so much passion. And one thing that you just said that I think is worth spending a little bit more time on here is that oftentimes you will have your clients push into discomfort a little bit as a part of the rehab process, and how that can actually be more beneficial in the long run. I think one thing that I often talk to about with my patients and clients is that if we're not doing work that is challenging, we're not going to create change. And I think this is a serious issue when it comes to rehab in all different realms, is that it might start out okay, but at a certain point, it's just not hard enough for them to continue to progress in the way that they would like to. So could you elaborate a little bit more on why it is important for us to push our clients and to push our patients into this realm of discomfort so that they can make the progress and they can work towards the goals in the way that they would like to?
Yeah, I think part of the reason we see better outcomes with people who lean into some discomfort is because now we're actually getting like a sufficient stimulus for a person's body. I think that's a lot of where it comes from, is like now we're actually like kind of at an intensity where you're training a little bit. And that's going to be a good stimulus for your body. And it's still recoverable for your body. It's still tolerable for your body. I think the other part of it is like challenging somebody, like rewiring their brain to be okay with producing that much force or using their body at that intensity. And it kind of teaches your nervous system like, hey, this is safe, like we can do this, we don't have to freak out. And it starts to become you start to become less and less sensitive, and you can start to push things a little bit more over the course of like a few sessions. I've had people come into my clinic who like had tweaked their back, and they were so afraid to like bend over, take off their shoes, do anything. And, through a little bit of graded exposure and like some conversations, they walked out of my clinic after doing deadlifts, like feeling amazing, because I think they just showed themselves like, hey, I can actually do something hard in the presence of some discomfort and like be okay. And I think that's like really reassuring to our patients and our clients.
And I think that's really the value in seeing clinicians that understand what your goals are and have the time and capacity to work with you in this way, because there will be a lot of people that come through that we work with that is very much probably the case, that if we provide reassurance, if we demonstrate to you as the patient that, oh, you can do these things and it's not as scary as you thought, and that it can feel okay, that you're able to progress in a way like the story just told, where, okay, you walk out of the office, you did deadlifts, you feel 90% better than when you walked in. These things can happen. But I also think our value as practitioners is for those people that maybe the issue is a little bit more serious, or you're in a place where that's not possible on day one. We can also create the plan for you so that that can happen. And it's not just about these steps not happening, but rather they might happen over a longer period of time. So instead of day one, this is extrapolated out to maybe a few weeks. And now in a few weeks, you're back to your goals. But someone who is very much going to encourage you to do the things that you want to do. And they're not going to tell you, you can't do this, you're never going to do that. They should very much be on your team in the sense that they're there to show you how you can do the things that you want to do, and it's not to simply take them away. Because as a reminder, as chiropractors and as coaches here, we're not working with the really big, bad, and scary stuff. We're not here to work with people that have the more severe diagnoses that are maybe life-threatening, of that severity and nature. When we're working with musculoskeletal issues, muscles and joints typically, those tend to be things that with time and with proper guidance, we can probably work through almost any issue. And there are probably very few things that we'll sit here and say, you cannot or you will never do this again. Most of the time, it is possible to get back to those things. The question is whether or not the person that you're working with has the ability to take you there. So if you've ever felt frustrated that, I said, I can't ever do this again, I can never run again, I'm never going to lift again, I'm never going to climb again because they said it's just too dangerous, seek a different opinion. because there's probably someone out there like Natasha or Devin or myself or the other hosts of this show that are in a position where we can help you towards those things, or at least sit down and have an honest conversation. So let's follow up into one more topic here, because I think this has been an awesome conversation so far, and I want to give the listeners just a few more points here. When you've had friends or family members that are maybe looking for care in other places, and they're working with someone who is not supporting them in the way that they would like, what type of advice would you give them? Because I think a lot of people these days, they kind of rely on proximity to work or to home, and they feel maybe limited by some of these factors. What advice would you give those people when they feel like they haven't found what they want, but they also can't find that in their near proximity?
Yeah, I mean, I think it's totally okay to have like a real conversation with your practitioner. And I've had clients who, were seeing somebody like that, someone in their area, and, they just had to have a sit down with their practitioner and be like, look, I'm going to show you some videos of like some stuff that I'm doing in my sport, and like to show you what it's like and like what I'm trying to get back to. And some practitioners will be able to work with you on that. Like you can have a real conversation with them of like, look, I think this is maybe not challenging me enough, or like for some reason this is not working for me. Here's where I'm trying to get. Here's a video of me doing it so you can kind of see what I'm trying to get back to. Like, how can we create a plan for this? Or do you know somebody who can help me create a plan with this? I think it's okay to like give your practitioner feedback. And even like for me within the climbing world, like I'll have people who saw one of my colleagues who I know well, and I know sort of like how they practice, and they'll be like, yeah, I don't know, it just wasn't working for me. And I'm like, did you have a conversation with them? Like, did you let them know? I know it's kind of hard to bring that up, but like, maybe you don't want to challenge them or something, but like, it's okay to be like, hey, I don't understand this plan, or hey, this is not working for me, and allow that person to have a chance to like work with you and work with your goals. Because sometimes it's just like that exercise didn't quite work for you, or that plan, for that configuration of that plan just is not working for you for some reason, and you can work with that person to fix it, and they can still help you. But you have to be able to have that conversation with them, and you have to give them the opportunity to help you. So sometimes I'll have clients who are like, yeah, I saw so-and-so from the climbing world. And like, yeah, she's not helping. I'm like, well, did you talk to him? I'm sure he could like modify this for you. Like, so talk to your practitioner. And then if that's not working, if it's still not working for you, you can work with somebody who works remote, like one of us, who maybe understands your sport. I think it's really important if you're somebody who's trying to get back into like an athletic pursuit, or even if you're a recreational athlete who's trying to get into something back to something recreational, that you work with somebody who understands the demands of like whatever it is that you're trying to do. And like, if you're a climber, try to find somebody online that you can talk to who understands the demands of climbing. Or at the very least, like talk to somebody who understands like strength and conditioning principles. Like I've had climbers go to like a PT online or a chiro online who was like a powerlifting, who worked with powerlifters, but they had an understanding of strength and conditioning principles and were able to understand what that climber needed and was able to get them to where they needed to be. So online is always an option. It's not like online is like kind of the next step down from seeing someone in person. It's just as good. Like, and I think in some people's minds are like, oh, I don't know, like in person is gonna be better because you can like see me. It's just as good, if not better sometimes, because that person's gonna understand like what you need to be doing. And if online is still not something you want to do, or it's not something that's possible for you, at least asking the people you are working with, or asking some friends, or asking some people in your network, like, is there somebody who works with our sport? Is there somebody that you've been to that like has helped you with this, and maybe you can go see them? Those would be maybe some of my recommendations.
Yeah, and I think main idea of kind of what you're speaking to is just like for people listening, like it's your rehab process, not anybody else's. So it's like it's okay to be curious. And if you give your practitioner feedback and they take it personally, like in my book, that's a red flag. Like probably
Yeah.
time to seek help somewhere else. Like that's the expectation I set for anybody I work with, where it's like, if problems arise, if we're having trouble, please, please, please tell me, because especially online, I'm sure you understand this, Natasha, but like we have less information to work with, or the information that we do gather is that much more important because we're not there with somebody during the session. So it's like, please ask questions. If something happens during the session or you're just not feeling good about something, bring it up and we'll tackle it together, right? And I think like the overall like feel to this relationship should feel like a team, like it's collaborative, like you're side by side working with one another, rather than this kind of like doctor say I do. Like you should have a role in that process. And I think that's just kind of the idea of patient empowerment and patient-centered care as well. Dave, did you want to wrap it up here? I could ask probably 100 questions on strength training alone, but if we need to do that in part 2, I'm totally fine with it. I'll let you kind of decide on that.
Yeah, that's a deep rabbit hole. I think we might save that for a part 2 if you're willing. But I think that it's probably an important conversation to have at some point in time. Is that and we'll reiterate this again right now? Is that whether you're seeing a chiropractor or a physical therapist or any type of rehab professional, as you're trying to get out of pain and you're trying to get out of injury, look for a few things. Look for their willingness to communicate with you. I think maybe first and foremost, honestly, like to me, that's one of the most important traits is, are they willing to take the time to listen to you, to engage with you, to be open to feedback and criticisms? Because the healthcare professionals that truly care and are truly passionate about this would never, ever be offended by that. Bottom line, they just never would be, because they are in it to help you as the patient and to do everything in their capacity to make that happen. So to me, communication is such a huge thing. And then as Natasha mentioned, if you have very specific goals, your practitioner should understand the sport or the demands of what those goals are. Because if they don't, there is no way to appropriately create a plan for you. So this is not to say that maybe the practitioner you're working with, you need to stop seeing them, but I think it's very much okay to find a team of people sometimes to work with as well. So maybe you do have your primary practitioner, and then maybe you have a coach somewhere else, and they're all working collaboratively to create this plan for you. This is not to say that you need to find the one person that's going to check off all of these boxes every single time. Sometimes it is multiple people, and that's okay. But I think when you look at the team that you're surrounding yourself with, that team should be able to check off all the boxes. So if you don't feel like you have anybody in your corner to check these things off, ask around. Like you said, ask that practitioner. I think a lot of us as healthcare professionals in the social media space, like we're willing to have conversations as well with people like, maybe we can't help you right now, but maybe we could also help point you in the right direction. There are so many people out there that are very much willing to put in some effort to help you. You do not have to settle for something that is not helping you at the level that you would like. So we'll put all your information in the description of this podcast, Natasha, but why don't you tell people like where they can find you and maybe a little bit more information about what working with you looks like.
Yeah, the easiest place to find me is on Instagram at Natasha Barnes, or my website, natashabarnesrehab.com. Obviously, I offer injury consultations for climbers, and I also do rehab coaching for climbers. So if we wanted to work together more closely for a little bit longer, that's an option. And I offer climbing coaching and strength coaching for climbers as well, if people are interested in that. And I also have a program that is specifically for strength training for climbers, because that's one of the biggest things I'm trying to bring to the climbing community is like getting strength and conditioning and strength training in general to the climbing community, because it's not something that and at least like years ago when I first started was like accepted, but it's something that obviously can really help athletes and help keep them more resilient. So I have a program for that too.
Check that stuff out, especially if you're a climber. I promise you will not regret it. All right, Natasha, thank you so much for spending time with us today. And thank you everyone who listened to this. And until next time, we'll see you then.
Yeah, thanks.